I'm gonna sit back here with her. Now I think we have something special. Kaylee sent something from Scotland. Hey, off. Hey. Off. Come on, I know, loves. Aw, what do we have here? We have a note. Read the note off camera first. Dear Ilsa, I hope you feel better soon. Love, Kaylee. We have a box of 3 Dog Bakery grain-free soft-baked wafers with a picture of a golden. There you go. You can eat some treats with a picture of a golden on them. And we have get well soon treats, little cookies. You can have those later when the doctor says you can. And a little hedgehog plushie. Hey, this is going to be your buddy in your crate. $20 from LF Teeks. Lots of love to you, Leonard. My best wishes for Ilsa. Very much appreciated, everybody. We are at $1,550 raised for Ilsa's surgery, which is amazing.
GoFundMe.
On GoFundMe. That is absolutely amazing, and I feel absolutely blessed to have your support and for Ilsa and all that. Words fail me to have the community be this supportive. It's nice. It's very nice to. I feel blessed. Maybe my coffee will be drinkable by the time we get back.
I wait in the car.
You're gonna explore everything, huh? Looks brand new.
Yep. Concrete smells good. Come on. Ilsa. Come on. You wanna go fishing? Listen to the other puppy that's in the other room. Very intensely.
My girl. Gentle. I got it. They've got a lake in the front yard.
That's what I said before. Here's the leash for a moment. I'll change places.
Okay.
No, I think we can go with my telephone. Other puppies.
Okay, so.
Other puppies.
Oh yes. So unfortunately, there's nothing else I can do this week. The soonest I'd be able to do would be. So you're coming from Eastern, I'm not too familiar with. We're on Hamilton. We're closer to. Do you know where the 78 entrance is by Allentown, Stony Park area? We're closer to that. Are you coming through 78 or no? Yes, actually, we're that whole new, we're like one light down, I think, 1 light or 2 lights down. But we're on Hamilton Boulevard side. Okay. Okay, and then if you know where the Walmart is, there's a street right after the Walmart. So you would pass the Whole Foods, if you're coming back to like where the Walmart is, coming the direction you're coming, the Walmart will be on your left, where the next street on the left. Okay, so then I'll typically call you between Tuesday and Wednesday just to confirm for Thursday. If you have any questions, bring it till 4:30, you can give us a call. All right, thank you.
She's excited because she wants to smell all the other dogs.
Mm-hmm.
That's what she wants.
And she doesn't know where she is either, but she probably knows the smell, but doesn't relate to it yet.
Well, I mean, she's only really ever had good experiences at the vet, except for that, you know, the very first one where she was just very sick. So I am very relieved after that. The doctor seems to know what the heck he's talking about. He seems to have a decent practice set up here. He was very ready to explain everything. They are not simply tying a ligament back together, but rather it's called TPLO. I'll have to look it up, and we'll maybe do a little thing about it, like a little video about it or something, where they actually, it's sort of like knee replacement surgery, but it's like a knee alteration surgery. And I think instead of replacing the ligament, they alter the angle of the knee joint so that the muscle tissue and other ligaments can support the knee biomechanically without the ACL. I don't know if they actually tie the ACL back together or not, but I'm going to look it up. That's super interesting. It ends up being a flat fee of $4,000, but I'm willing to pay that for the best surgery that we know that we can get for the dog. So say goodbye to the animal hospital, and this is Dr. Salvador Galindo on Hamilton Street in Allentown. If you make a left to Tractor Supply, we gotta go get food for the dog for when she's in recovery. Out here. And then we're gonna get breakfast and food for ourselves because I haven't eaten anything either. See you later, and thank you so very, very, very much for your support. Really appreciate it. So it seems like TPLO surgery is tibial-plateau-leveling osteotomy surgery, where they alter the angle of the knee. They cut the bone and then shift the angle of the top of the bone, and then it looks like there's some kind of plate and screws that holds that together.
Okay. But do they do that because of wear?
They do that, I think, to overcome the dog's need for an ACL. I think they don't replace the ACL. This angle then restores the joint operation. So instead of a sliding or twisting or back and forth, it's now back to being just a hinge, which is what it's supposed to do. It's supposed to be a hinge, like this.
Didn't the ACL give you side movement a little bit too, also?
No, you're not supposed to have side movement, because very much like my knuckles are fitting together, those joints fit together like that. And so if they're sliding around, you're actually wearing out those, the alignment of that joint. Eliminates, by doing so, this eliminates the need for the ACL ligament entirely and returns stability to the joint immediately. Once the knee is stabilized, the dog will begin to use the limb again. In most cases, the dogs are weight-bearing within a few days, if not the very next day. So the only reason why she might not be weight-bearing is because she has atrophied a little bit, because it's been a few months. And she has some reduced function in her muscles.
How sore is it going to be on top of it?
No, what they're saying here is that aside from being sore, like the joint and the muscles are fully stable the next day. Like right after surgery, you've actually corrected the problem, as opposed to created a slight injury that will then need to heal. I mean, aside from the surgery wounds, you're not tying a ligament back together that then has to heal. You're correcting the problem, and then just the bone has to just, where they cut the bone has to fill with marrow and heal up, and where they cut the leg has to fill with scar tissue and heal up.
So this sort of just keeps it on course and keeps it together.
Yeah. It says here the surgery has proven itself time and time again, extremely effective. I'm
Hey folks, how are you?
very happy with this so far, and feeling much better, aside from just needing to now de-stress a little bit because I've got myself all worked up. But this looks really good. So the doctor just called, and good news on Ilsa. She is out of surgery and doing well. And she is expected to make a full recovery on the right knee, but the left knee is also torn. The right knee was completely gone, he said. I've got some mosquito trying to bite my glasses. And the left knee is not completely gone. So he does not recommend surgery right away. He says wait to see what happens. See if the recovery period for this surgery allows her left side to heal a little bit too. I don't know, given enough time, it's like months, but if we're not going to be playing rough for the next 6 months, then, and I can keep her to that, then she has a chance. And if not, well, I should be saving some money so that I can do this again on her other knee. The other thing he said was that her hips are good, maybe not great, but her hips are good, and that's not a it's not at a level where anything would need to be done in her hips, with her hips, in her lifetime. He doesn't think. So that's good news for Ilsa. So hopefully no hip problems, but maybe the other knee has to be done. Great. So thank you very much. I feel so very, very relieved that my dog is okay. I'm very relieved that I have all these mosquitoes biting me. Very relieved that I have all of your support and love through this whole thing. It really means a lot. And I'm gonna go inside now after throwing the ball for Nico a few more times and maybe spraying myself with some bug spray. And this boy and I get to play a little bit because he hasn't blown an ACL and he's not going to now, is he? No, I love you. I love you very much. Look at this. He has these little blonde highlights. Do you see this? He has little blonde highlights. This perfect looking dog. You are a doll. Where's the ball? Let's play for a moment. Look at this. Look at this boy. Look at this happy dog. He just wants to play. He hasn't been able to run and play because Ilsa's been holding him back. So we pick up Ilsa tomorrow morning or sometime. We call tomorrow morning and find out when to pick her up. And so I'll have more video tomorrow to update you on Ilsa with, I guess, video of her recovering. Thank goodness. So relieved. My dog is okay. Love you guys. Thank you so very, very much.